Hi, I am Dr. Harsha. I am the Cornea, Cataract and Refractive Surgeon at Narayana Nethralaya, and I'll be talking about some of the do's and don'ts following cataract surgery. So once you have undergone cataract surgery, there are certain precautions that needs to be taken to prevent any untoward complications and for better healing and getting good vision. So the most important thing is to follow the prescription that has been given. This prescription will have complete details about the drops that needs to be used, the time of use, and for how long duration, etc. So this has to be used as per the time schedule mentioned. Also, the person who is going to apply the drops to the patient needs to wash their hand before they apply the drops. The proper way of opening up a new bottle of the drops is to tighten the cap so that the sterile needle provided within the cap perforates the tip and opens up the bottle, rather than using safety pin or other sharp objects to open, which can cause infection to the eye. Once you are putting the drops, advise the patient to tilt their head backwards and upwards and pull the lower lid down and put one drop of the medication behind this lower lid. And once the drop is applied into the eyes, tell the patient to close their eyes for 30 seconds, and any excessive drops that comes out needs to be cleaned with the wet wipes that has been prescribed along with the drops, and discard these wet wipes after one use. So if there are multiple medications that you are using, give a gap of 5 minutes between two drops so that there is sufficient time for the drops to get absorbed. Apart from this, if the patient wants to do any exercise or something, it's always better to go for simple things such as walking or very mild exercises. And if the patient wants to read, they can start reading after maybe 3 days by using their old glasses till a permanent glasses given to them. If the patient is into two-wheeler driving, it's better to avoid it for the initial 1 week. And then after that, it's better to wear a protective glasses and a closed helmet over it to avoid any dust getting into the eyes and thereby getting infected. So coming to some of the don'ts that needs to be followed. So it's better to avoid head bath for up to 1 week post surgery, and avoid swimming or getting into any holy dips for up to 3 weeks. Earlier advised, it's always better to avoid any strenuous exercises or yoga for the initial 3 to 4 weeks. And avoid touching your eyes unnecessarily, as this can induce infection. And also it is very important that you do not stop any systemic medication that has been given for the treatment of diabetes or hypertension, as these do not interact with any of the drops that has been given for cataract surgery. Thank you.